That is where senators grilled RFK Jr. yesterday about the COVID-19 pandemic. Our next guest is looking at the possible public health dangers ahead under Kennedy's leadership. Joining us now, director of the University of Minnesota Center for Infectious Disease Research, Dr. Michael Osterholm. He's out with a new book, The Big One: How We Must Prepare for Future Deadly Pandemics. Dr. Osterholm, it's great to have you back with us. You were so instrumental in guiding us through the pandemic through all those years. So fascinated to talk about your book, but I'm also curious, as a physician and given your area of expertise, what you made of what we saw yesterday on Capitol Hill in the testimony from RFK Jr.
I think, first of all, cutting through the political theater, I have to say in my 50 years in the business, I've never seen a more dangerous time for public health. We're watching its destruction, not just in this country, but throughout the world, largely because the U.S. pullback on such things as PEPFAR, USAID, being part of the WHO. And when you add that all up right now, this is a serious challenge that I don't think people really realize the extent to which it threatens the very public health structure that we've so relied upon for the last 100 years.
Yeah, and Doctor, what you're writing about is the degradation of the public health service that we saw on display yesterday up on Capitol Hill, at the same time that we could be facing something as a planet more serious, you're saying, than the COVID epidemic that we all thought was the big one.
And in fact, what people have to understand is we are constantly in a battle with microbes. And if you look at all the wars of the last century, which of course have been significant in terms of what they've done, microbes still kill more people. And we don't really realize that that war that we have, you can never let up on. And just as an example of why what's happening right now is so relevant to this, is if we had an influenza pandemic right now, which we could easily have one today, we have only the capability to make vaccine for about a quarter of the world's population in 12 to 15 months after, in fact, the pandemic begins. Millions would die, would never have access to the vaccine. The very program that was likely our gift to get out of that is the mRNA technology that Mr. Kennedy has just basically withdrawn all the support for. And so if we had that technology, we could probably make enough doses of vaccine in the first year to vaccinate the whole world.
On vaccines and what we heard yesterday, one of the things that seemed to need some clarifying was whether, at one point, Mr. Kennedy was saying, yes, everybody has access to vaccines who want them. And the senators were saying, well, hold on a second. If you're saying that only healthy people need the vaccine, then that actually starts putting a chill on the system in providing those vaccines. Can you talk about that a little bit more? Because I thought that needed some clarification.
You know, he tries to nuance this in such a way as it makes it sound like it's clear, but it's not. There's great confusion right now. Not only can I get a vaccine, but who will pay for it? You know, this past year, we had over 160 kids in this country die from COVID. Most of those individuals had no known risk factor for having serious illness. So if I'm a parent today, I'm not being told I have to vaccinate my child, but please don't take the vaccine away from me if, in fact, I want to do that. And right now in this country, according to Mr. Kennedy's guidelines, you could not get a vaccine for a younger child. It would be something that many of the doctors and pharmacists who administer vaccines said, I can't do that because it's not something permitted. So it's much more than just a recommendation. He is putting barriers into this. He's also creating great doubt. Yesterday, he said again that there's only one study that's ever been done that's looked at childhood vaccines from the standpoint of what we call a randomized controlled trial, where half the kids get the vaccine, half get a placebo, nobody knows who, and therefore at the end, basically, you can really rely on those data. We have 511 such studies that have been published, and he knows this. He knows this, and he still elects to say these things. And that's hard because that's what's confusing the public right now.
Yeah, it's hard. It's extraordinarily dangerous. And the new book, The Big One: How We Must Prepare for Future Deadly Pandemics, is out now. Director of the University of Minnesota Center for Infectious Disease Research. As always, Dr. Michael Osterholm, thank you so much for being with us. Thank you.